My name is Danielle. I'm a student nurse at Holyoke Community College, and today I'm doing my head-to-toe assessment. Kristen?
Hi.
Hi, Danielle Burby, student nurse at Holyoke
Hi.
Community College. Come on in. Have a seat.
All right.
What time was your appointment?
2 o'clock.
Excellent. And why are you here today?
A physical for a new job.
Excellent. Can you just confirm your information here for me?
Yep, that's me.
Excellent. When my patient walked in, she was alert and oriented ×4. She knew time, place, location, and situation. She came in with a balanced, coordinated gait. She's clean, appropriately dressed for the situation. There's no odor. Her posture is good. When I shook her hand, her skin was warm and dry and intact. There were no open areas, there were no lesions, there were no moles, there was no discoloration or petechiae, there was no bruising, no rashes or no scars. As I'm checking her over, I'm going to be checking all of her skin for those types of things, anything that I would be concerned about. I'm going to start your physical today with some vitals. Okay. I'm going to take your blood pressure and your pulse, and I'm going to check your respirations. While I'm checking her pulse, I'm going to watch the rise and fall of her chest to check her respirations as well. Her pulse falls within the normal limit of 60 to 100. Her respirations were 14, which is in between the normal ranges of 12 to 20, and her blood pressure was 110/75, which falls in the normal ranges of below 120 to 120/80. I'm going to make sure that the door is closed. I'm going to provide privacy for her. I'm going to wash my hands. I've already introduced myself. I'm going to explain as I go along, and she's in a safe environment. All right, I'm going to start by checking your scalp for any irritation or open areas. Your skin looks good. I'm going to check your ears. I'm looking for any open areas or drainage or redness with her ears. And they look good. I'm going to check her eyes and her nose. And can you open your mouth and stick out your tongue for any open areas or drainage? Can you move your tongue from side to side? Her tongue shows good mobility. The mucosa of her mouth is pink and intact and moist. So I'm going to dim the lights, and I'm going to check in your eyes for reaction to the light. Just look straight ahead of you. Good. Good. When I shed light in her eyes, the pupils contract, and when I move the light away, they dilate. Follow the pen with your eyes. Good. I'm testing for accommodation. As the pen moves in, the pupils constrict, and as the pen moves away, they dilate. If you can just follow this for extraocular movement, move just your eyes, not your head. Very good. One more time in your mouth. Very good. I'm just going to check your glands. Good. While I'm feeling your neck, I'm going to check the carotid pulse. Strong and equal on both sides. Good. We're going to check your range of motion. If you could raise your hands above your head. Good. And make a loop with your arms. Good. And arms straight out in front of you. Palms up. And bend them like you're lifting weights. Very good. And your wrists, just your wrists up and down. And fingers out and fingers in. All right, palms up. Don't let me push your arms down. Good. And don't let me push your arms up. Very good. I'm just going to check your brachial pulse while I'm here. Good. Equal on both sides. And your radial pulse. Good. Equal on both sides. Now I would have used the radial pulse to check her pulse during her vitals, and I would have checked it for a full minute at that time. So I'm just checking to make sure that they're strong and equal at this point. All right, can you kick both of your legs out? Good, and can you point your toes? And flex your feet. Very good. All right, and raise your thighs up off the bench. Good. All right, push up against my hands. Good, and push against my hands. And pull back. Very good. And lift your toes up and push down. All right, while I'm down here, I'm going to be checking her femoral pulse and her popliteal pulse and her pedal pulse. I'm also going to be checking for capillary refills on her toes, and I'm going to be checking for any edema in her lower extremities, and she looks great. All right, my patient is in a joint now. I'm going to have her stand up and take a look at her spine. If you could stand up, I'm going to be touching your skin. Is there anything culturally that I need to be aware of? All right. Go ahead and bend forward like you're going to touch your toes. I'm going to be checking that she has scapular alignment. I'm going to be checking her spine for any curvature, any kyphosis, lordosis, or scoliosis. I'm going to make sure her hips are level. I'm going to be checking for any bumps, bruises, masses in her skin or under the skin, and she looks really great. So go ahead and stand back up and have a seat. I'm going to take a listen to your lungs.
All right.
I'm going to check in the back first. And I'm going to be checking in the intercostal spaces. In practice, we would be doing this against skin, not on top of bone, not on top of clothing, but for the video, we're going to stay fully dressed. I'm going to be listening at the 1st, 3rd, 5th, and 7th, and 9th intercostal spaces. Can you take some deep breaths, please? And I'm going to use a Z pattern as I move down her back. And then I'm going to listen to the 2nd, 4th, and 6th spaces on her lateral breath downs. If you could put your arms over your head for me. And some nice deep breaths. Very good. And now I'm going to listen to the front. I'm going to listen in the clavicular area and then at intercostal spaces 2, 4, and 6. Nice deep breaths for me. Okay, and now I'm going to listen to your heart. I'm going to listen at the 5 points in the heart, the aortic, the pulmonic, the tricuspid, and the mitral. When I reach the mitral, I'm going to listen to the heartbeat for a full minute at the point of the apex. Okay. I'm going to check for capillary refill in her fingers. And hers is good. Anything longer than 4 seconds is considered sluggish. If you wouldn't mind laying back, I'm going to take a look at your abdomen.
Sure.
I'm going to be inspecting her abdomen for any visual abnormalities and be looking again for lesions or masses, bumps, or bruising. And then I'm going to listen to her bowel sounds in all 4 quadrants. So I'm looking at her skin, and everything looks good, so I'm going to go ahead and listen to all 4 quadrants of her abdomen. I'm listening for active bowel sounds. If I don't hear anything, I have to go for a full 5 minutes to conclude that there are no bowel sounds. She has active bowel sounds in all 4 quadrants. So I'm going to palpate her abdomen. I'm going to be feeling all 4 quadrants, and I'm also going to be feeling over the pubic symphysis for her bladder. Everything is soft, it's non-distended, and everything seems fine. There's no pain or tenderness?
No.
Okay. There was no facial grimacing or guarding while I was palpating her abdomen, so everything seems to be fine there. Go ahead and have a seat. Are you having regular bowel movements?
Yep.
Okay. And when you urinate, do you have any burning or urgency?
No.
Any excessive frequency?
Nope.
Any sort of incontinence with urine or with bowel?
No.
Excellent. And are you sexually active?
Yes.
Okay. Do you practice safe sex?
Yes.
Are you on any sort of contraceptive?
Condoms and birth control pill?
Perfect. And when was your last period?
Oh, a couple days ago.
Okay. And do you perform monthly self-breast exams?
Yes.
Okay. Now, if my patient had been male, I would have asked him about doing self-prostate exams and self-testicular exams. Do you have any further questions?
No, I don't think I do.
All right. Well, everything looks great. Everything was within normal limits, and it was a pleasure to meet you.
Thank you.
Thank you.